Now I will discuss the other part of the rickets that is called renal rickets. It occurs in chronic renal failure in which kidneys are unable to form the active form of vitamin D. Exogenous replacement with 125 dihydroxycholecalciferol calcitriol is an effective therapy. Signs and symptoms of rickets. Rickets Rickety bone has less inorganic matter, which is the primary defect in rickets. Collagen cells at the end of the long bones continue to proliferate. Osteoblastic activity is increased as shown by the increased level of alkaline phosphatase. Epiphyseal lines becomes widened both laterally and in depth so that nodules develop at costochondral junctions, rickety rosary and at wrists, ankles and knees. Tibia bends forward, bow legs, femur outward, and spine shows kyphosis and scoliosis. A transverse groove appears corresponding with the insertions of diaphragm on either side of the thorax horizon sulcus. Sternum protrudes forward, pigeon chest. It is the most dangerous deformity because it interferes with the pulmonary ventilations. The frontal and parietal bones protrude forward, boasting of head. Skull shows craniotapes, softening of skulls with widening of sutures and fontanelles. Delayed closure of fontanelles. Retarded eruptions of teeth. There is delay in dentition. There may be defective enamel production which predisposes to decay or caries. The child has poor abdominal musculature and develops port bellies, sign of debility. Thank you very much. Now, I would like to discuss lab diagnosis of rickets. Plasma calcium level is decreased initially but is later raised due to increased activity of parathyroid hormone. Serum alkaline phosphatase is increased. This finding is of help in diagnosis. Osteomalacia. It is due to deficiency vitamin D deficiency in adults. It is not rickets in adults. Osteomalacia is entirely different from rickets. It is characterized by demineralization of pre-existing healthy bones with increased susceptibility to fractures. Occurs mostly in women who are economically poor and undergo repeated cycles of pregnancy and lactation. Lactation puts relatively more burden than pregnancy. Signs and symptoms. Bone minerals are mobilized. X-ray show generalized decrease in bone density. Bone becomes softer than in rickets. Weight causes bowing of the long bones. Vertical shortening of vertebra occurs. Spontaneous fractures and collapse of the vertebra may occur. Flattening of the pelvic bones, which shortens the pelvic outlet. Contracted pelvis is an important cause of difficulty in children. Calcium level may decrease to a level where tetany may result. Now, vitamin E, tocopherol. Sources of vitamin E. Animal sources: meat, liver, egg, fish, liver oil, milk. Human milk is 2 to 4 times richer than cow's milk and butter. Plant sources. Plant sources are the best. They include wheat, germ oil, cotton oil, peanut oil, and all green leafy vegetables. Thank you very much. रमजान साहब आप बोल सकते हैं?
जी सर, मोस्ट वेलकम।
ठीक है, स्टार्ट करें।
औज़ुबिल्लाहि बिस्मिल्लाहिर्रहमानिर्रहीम। हमारा जो फास्टिंग और उसके साथ जो इन्फ्लेमेशन के बारे में हम डिस्कस कर रहे थे, रोज़ा हमारे लिए निजात है और हम मुख्तलिफ बीमारियों से रोज़े के ज़रिए बच सकते हैं। हम मुंह के ज़रिए खाते हैं, हमारा जिस्म तमाम किस्म के जो न्यूट्रिएंट्स होते हैं उनको अपना हिस्सा बना लेता है। हमारे जिस्म को जलाने के लिए बहुत ज़्यादा विटामिन्स की ज़रूरत होती है और इसी तरीक़ा से हमारे जिस्म को